Hello, everyone, and thank you for taking some time to watch this information session dedicated to athletics and a look at spring 2021. I'm Christy Tosteven in University Communications. I'm really happy to have with us today Nan Carney DeBoard, who you all know very well as our athletics director. We also have Trish Harris, who's our head trainer, and Dustin Brentlinger, who leads our wellness center on Denison's campus. And we're really excited just to share with you our plans for spring to the extent we know them today. I think you heard from us very frequently throughout fall, continue to be a theme this year. They're going to be flexible and agile, but we also want to share information with you when you have it. We're going to focus a lot today on the health and safety measures that we're putting in place for our student athletes. And as you know, you'll continue to hear through forums like this, but especially from your coaches about what's happening with your specific team, plans, schedules, those sorts of things. So you'll have a lot of information coming your way over the next few weeks and months, but we're really excited to get this semester started. I just want to remind you before we launch into things that are athletic specific, just of some of our general plans for spring semester that apply to all students. So one, I hope you're aware and you're preparing to take your pre-arrival test. We're requiring all students to submit a test before you get to campus, submit proof of a negative test, or if you've had COVID in the last 3 months before coming to campus, you can submit proof of that positive test for us in place of taking a new test. We also hope that you are starting your symptom monitoring and tracking that through the wellness portal. We want you to do that 2 weeks before you arrive so that you're back in the habit of it, and so that we are starting to track and monitor student wellness. You'll also be receiving hopefully this week, you'll be receiving from student development the community care agreement to sign before you come on campus. Largely the same as it was last semester, but just asking for those who were here to recommit to those behaviors. And if you weren't here in fall, for you to commit to those for the first time. And with that, I am going to hand things over to Nan. Nan, can I ask you just to start us off with talking about kind of our philosophy and our approach to athletics for spring 2021.
Thanks so much, Christy, and welcome everyone. As you know, I miss you all and can't wait to have you back on campus. And just generally speaking, much like the fall, I can't emphasize enough how much we are committed to providing an exceptional experience for all student athletes, obviously winter, spring, and fall. And we have worked since your departure extensively on how we can possibly do this. So regardless of what type of competitive play that will occur, coaches, trainers, strength and conditioning staff, and myself are working as we did in the fall to really create the most meaningful experience for all of you. And to maintain your competitive advantage on the field of play, but also contribute to personal and team development. Now, specific to competition, we have been working incredibly hard to arrange for all winter sports to have some level of competitive play with obviously our conference institution and other schools who are willing and able to meet ours and the NCAA's strict health guidelines. We are still in discussions about spring competition, but that is coming together pretty quickly. And I will be meeting individually with spring sport coaches and individual teams as necessary to keep you all updated in real time. I want you to have as much information as possible as we've developed it and learned it. I do want to reinforce a few key points before we dive into the details about spring semester. First and foremost, we are committed, as you know, to the health and safety of every student on Denison's campus. And for this conversation, specifically our student athletes. Number two, we learned a lot from fall and feel confident in our plans for spring. However, with that said, we will remain agile and responsive as a college, as an athletic organization, but also within individual teams. So finally, we will adjust plans and schedules based on the environment, and we will make decisions always with the primary goal of protecting the health of our student athletes, our coaches, our staff, and most importantly, the entire wider Denison community. Once again, as a college, we did have a successful fall semester. And I've said it before, I've said it individually and collectively. I can't thank you enough, and I truly appreciate the leadership that you showed, and the commitment to your teammates and to our campus community. And I want you to come into the spring semester with that same mindset. It will be critical that each of you come back to campus just as committed, and even more so for spring semester. We're not going to be able to have an adjustment period, so we've got to be ready. We are fortunate, we are very fortunate to have the opportunity for competitive play. But as I've said to you, just generally speaking, regarding athletics, remember, it's a privilege, and it's a privilege that many schools are not offering their students. And we need to protect that, and we will protect that. So this is the way we protect it. It's through our behaviors. Following COVID health guidelines, not only when practicing, training, and competing, but we will give you the specific data if we have the opportunity to travel and in your day-to-day activities. And that's everything from eating in your dining halls to collectively gathering in, outside of the dorms, or on your way to practices or anything like that. So we really will give you all of the information you need to have a success this semester. Just like last semester, we need to follow mask wearing and physical distancing rules, and follow other guidelines in terms of everything from athletic training facilities to locker rooms to any athletics facilities being used. Your strength and conditioning staff did a tremendous job setting up those guidelines, but also having a really strict cleaning protocol in place, and we need you to help with that. We also need each of you to follow other guidelines governing social gatherings. And like I said before, off-campus travel and in-room guests. These guidelines are being created with student feedback in mind. We are working to strike a good balance between providing a healthy and safe environment while allowing for robust social opportunities. So all students will be expected to adhere to guidelines. And for student athletes, we have high expectations of you, not only because it's so important in order to preserve our ability to compete, but also because you are leaders on campus and you cast a shadow for others. We believe that you influence the behavior of many of our students on campus, and we want you to do so. But I want to be honest and candid with you, and the stakes are even higher this semester because we have competitive play on the line, but also because if violations of the community care agreement will result in a loss of residential privileges, and then therefore your academic progress would likely be impacted, and none of us want that. So last semester, all courses were offered remotely, so students could easily finish the semester at home. That is not the case this semester. Not every class will have a remote option, so if students lose residential privileges, it is possible they won't be able to complete all of their courses for the semester. But specific to athletics, they will not be able to compete. So as most of you know, I like to put things in really succinct forms. And so I just want to reiterate the following for our specific early arrivals. The first two teams that will come back are both men's and women's basketball and women's and men's swimming and diving, soon to be followed by track and field as well as fencing. And just remember that being permitted to move back to campus early is a privilege. and that begins January 15th. So beginning January 15th, we ask for the following 8 points. First, remember, you will be tested for COVID by Denison upon arrival. If you miss the testing window on your date of arrival, you must test within 24 hours of your arrival. Secondly, after you receive your negative test result, you may have up to 2 people in your room. All guests must depart your room by 11 p.m. Third, non-student guests are not permitted on campus during this time. Fourth, no parties or social events are allowed in your room during this time. You may continue to gather outdoors. Fifth, you may gather in residence hall, common rooms, lounges, adhering to posted COVID capacities. 6, off-campus travel is only permitted to pick up necessities and groceries from Granville, Newark, or Heath. 7th, and another reminder, as you are expected to wear masks at all times unless you are alone in your room. And finally, when you are around others, please ensure physical distance of 6 feet. Obviously, this is outside of your practice environment. While the stakes are high this semester, and we have spent an enormous amount of planning, I really believe, and all of the leadership in athletics believe, the benefits and rewards are significant. And I believe we can have a great semester. I believe we will remain on campus, and we will have the opportunity to play competitively in a way that many schools may not have that opportunity. But in short and succinctly and in summary, we believe in you, and we believe in you as incredible student athletes. And with that, I turn it back over to Christy, who's leading our conversation today.
Thank you so much, Nan. I just want to say a couple of things and follow up to what Nan said before we move on. One of the things we heard a lot last semester from students is being fearful of breaking COVID-19 guidelines, or being found to have violated our community care agreement, and the fear of being sent off campus. Nan is right that this year, if you lose residential privileges, it does have a different and more severe connotation, because not every class will be taught remotely, and it might mean that you might not be able to finish all of your courses for the semester. But I also want to be clear that every violation of the community care agreement does not mean you are going to be sent home. So, we are working, and we will share with students some more specific guidelines around community care agreement violations. But, if you mistakenly violate the community care agreement, or if you violate it in a way that has minimal or moderate impact on the community around you, you're not going to be asked to leave campus. We'll teach that. We'll respond to that as an educational opportunity to help you understand the violation and the impact that it had, and how to behave differently going forward. It may mean that there are other ways we will take action before we would ask somebody to leave campus. So things like maybe a temporary loss of some on-campus privileges, like the right to have guests in your room. Maybe, you'll have a few weeks where you wouldn't be able to do that. Maybe, to Dan's point, maybe you wouldn't be able to practice or participate in competitive play if you violated the community care agreement. I also wanted to say thank you, Nan, for those 8 points. And I just want to be clear, those 8 points that Nan reviewed are for students who are coming back to campus early. So I just want to say we will provide specific guidelines for expectations for students once all students are on campus. What are those first few weeks of campus going to look like? And then what are the guidelines for the rest of the semester? We'll provide those to you as well. But I appreciate, Nan, and I think that's really important, being clear about what happens between the 15th, when student athletes start to move in, and when the rest of the students arrive too. So Thank you for that. And now we are going to move on. And I am just going to ask, if I can, Trish, I know Nan mentioned that we've done a lot to prepare for student athletes to come back. I'm just wondering if you can give us kind of high level what that's going to look like, the protocol and procedures we've put in place to support student athletes.
Hi, thanks, Christy. So first and foremost, I want to reiterate points that have already been made is the most important thing that we're going to focus on this semester is our mitigation factors, the mask wearing, the hand washing, and that's important in order to prevent the spread of COVID-19. As it was mentioned, it is highly prevalent in the community. So we want to make sure that we're doing everything that we can, especially since we're now being afforded the opportunity to go off campus and play outside opponents. So we want to make sure that when you come to campus, you have adequate masks. Ideally, one for as a travel mask, one for in-game. So it's just things to think about as you're packing. We have made arrangements, or we've made rules in terms of travel. Making sure that we're following the same masking procedures and protective procedures on the bus as we're traveling, so that we don't have a spread there. Through NCAA data, we know that the majority of spread amongst teams that you might be seeing in the media is coming not from the actual competition floor or field. It's actually coming from team events such as team meals, housing on the road, bus rides. And so we're trying to find ways that we can prevent as much risk as possible, or as much spread as possible, as we travel to other schools. Part of that is going to be our testing procedures that we will go over in a few moments with Dustin from the health center. We also ask that as you come back, we want full compliance, not only with testing. You will be tested often as a varsity athlete and for most teams based off of NCAA recommendations, but we also want compliance with contact tracing team. In order to prevent the spread and make sure that we successfully make it to the end of the semester, we need to comply with that contact tracing team. The other point I wanted to make, as Christy mentioned at the very beginning of our town hall here, is to communicate with us if you've had COVID-19 over the extended break. That's not only important just for the testing when you return to campus, but it's also important for us to track you. We are finding that even with mild and asymptomatic cases, we are seeing some rates of myocarditis or other inflammatory issues that are affecting athletes. And we want to make sure that we are following you, making sure that you're getting tested and trying to prevent and screen for that as much as possible. We ask that you not only upload that to your Denison Wellness portal, but you also communicate that through your team athletic trainer. We are ready and prepared to help you with advice as to what to do in the meantime while you're waiting to return. We just want to make sure that we're keeping you as safe as possible this semester. Other things that are going to remain the same for those of you who are here in the fall, we're going to continue spacing our appointments out, making sure that everything has been emailed, allowing us time to clean in between with our scheduled appointments, scheduling before practice. We want to try to de-densify our space as much as possible, especially if we have more teams going this semester than we would normally have. And so it's really important. I can't stress enough the communication piece and making sure that you're not only communicating with us when you need to come in and see us, but you're communicating with us about your health and how you've been feeling over break. So as far as testing goes, each sport is being classified based off of transmission risk. And within the transmission risk classifications, the sports have recommendations for frequency of testing. We are working really closely with our health center to set up a testing cadence to match what the NCAA recommendations are. And we want to make sure that we're ensuring proper monitoring of viral health among our teams in athletics. And we want to try to do this by preventing the spread and catching cases early on. Our higher transmissions sports are basketball, volleyball, and squash, and that's just the nature of them participating in a smaller indoor facility. It's very difficult to wear a mask while doing those sports, and they're going to be classified at a higher risk and tested more frequently. Football is considered a higher risk sport due to the nature of the line of scrimmage, the repeated contact amongst players over the course of the game that could add up to the 15 minutes, which is what the CDC is using to classify as a contact. And soccer, field hockey are also considered a higher transmission risk. And again, it has to do with the nature of the one-on-one situations throughout the course of the game. Our intermediate risk sports are situations where athletes are in closer proximity, but in short, they'll be close in proximity, but short and sometimes repeated segments of time, such as baseball, softball, men's and women's lacrosse, and indoor track and field. However, in some of these cases, some athletes may have closer contacts throughout the games. For example, catchers and umpires in baseball and softball. So with that, we're also going to be monitoring and requiring the reporting of health status from our officials in not only baseball and softball, but as well as basketballs. We want to emphasize that frequent testing does not mean that we still do not have a risk of spread. This is not to prevent or present some false sense of security. We really want everyone to understand that this is just one part of a mitigation plan for prevention. Frequent testing, when it's combined with mask wearing, frequent hand washing, and social distancing, is what's going to keep us here on campus through the spring. Like I said before, we're developing that testing cadence that will fit with the NCAA recommendations. We expect full compliance with team testing, especially if you intend on participating in a varsity sport. You will have to be tested in accordance with those NCAA recommendations. And with that, I'll turn it over to Dustin to kind of highlight some more specifics on the COVID-19 tests.
So thanks, Trish. We've got a lot of great opportunities this semester that maybe we didn't have last semester. And so I'm excited about how we can work better with athletes to make sure that they have safe and hopefully extremely competitive play, hopefully always beating whoever we're playing, of course. So let's talk a little bit about the kind of tests that we had last semester. We had kind of two tests that we depended on. One was an OSU PCR test and one was a Vault lab test. The OSU PCR test is the one that we use typically on a Monday for surveillance testing. We did about 200 tests every Monday, sent those into the Ohio State lab and got results typically from 1 to 5 days, depending on the time of the semester. The Vault test was the one that you used as a saliva test. All students would have done that at some point in time. And that one, again, was always sent into the lab. The lab would process the test and then send us the results. Typically, we could get that back within 2 to 3 days, and sometimes a little bit sooner. There's a lot of different things that are out on the market now and some things that we're going to add. One of the things that we used at the end of the semester last semester was called an antigen test. Antigen test is something that you typically use for someone who is symptomatic. And so you usually use it for someone that is in clinic and you know that they are ill and you're trying to determine what that illness is. An antigen test works best, again, on those symptomatic patients, but typically it's not as good on asymptomatic students or students that are not showing any kind of symptoms of COVID. And so there's been a lot of work that has been done around antigen testing. And it isn't that the antigen testing has become more accurate as much as that the states have used it in congregate living as a way to test more often. The great thing about an antigen test is that you get an answer back in 15 minutes. It's a test that we can process on campus, and immediately about 15 minutes later, we have a pretty good idea if someone has COVID-19. So congregate living places have been using it, such as nursing homes. And what they've been doing is instead of doing a weekly test like we do with the PCR, they've started doing multiple tests per week. And so you improve the accuracy by testing more often. Where the antigen test has a lot of great opportunity is that we do the test, 15 minutes later, we know that that person is positive, and we can place them into isolation in order to isolate the virus. With a PCR test, we didn't typically know until at least 1 day later, possibly up to 5 days later. And so anyone that had contact with that person had to be placed into quarantine, had to be tested, and were typically in there for 14 days. So the antigen test allows us to remove the virus from campus much quicker and keep it from spreading through different people. But again, it's not quite as accurate as the PCR test. So we have a protocol where we do antigen testing. Depending on what the results are, we may follow it up with PCR. What that basically means is it provides us the opportunity to be more flexible in the way that we work with athletes to make sure that they have safe play. and that our students remain healthy on campus. We also are looking at different tests that are a little bit easier logistically to manage. And so you all have experience using the VOLT test, the saliva test, where you provide a sample, you close up that sample, and you deposit it with us. It's pretty much a self-administered test. The antigen test that we're looking at is called Abbott BioNext Now test. And it's a nasal swab, but it's a nasal swab that you can do yourself, and it only the tip goes into your nose. It's not like the OSU test that has to be performed by a provider. Again, that test is self-administrable, and so we're able to let you do that on your own. All we have to do is supervise you doing it. Same thing with the VOLT test. So for athletes this semester, we're going to use a combination of both PCR testing and antigen testing. And your specific team and your specific risk factor will determine how often you're tested and by what tests we test you with. Every athlete will be tested at least once a week. Will be tested on a regular basis with that PCR test, which is going above what the NCAA recommends. But those high-risk sports will get those antigen tests also throughout the week in order for us to detect any kind of infection much quicker. We're working with the athletic training staff right now to understand logistically how does this make more sense. Last semester, it was tough for students to always show up on a Monday and find time in between their classes to come for PCR testing that required a provider. If we can do the self-administered test, we can open up more hours. We can allow you to schedule them weeks out in advance so that you know each week on maybe a Tuesday at whatever time you decide you're going to come in and you're going to do your testing, complete it, pass it off to us, and we will analyze the test to make a determination whether the test is negative or positive. So hopefully with that, that's going to allow us not only to do a better job of detecting the virus on campus, but also make it easier for students to participate in that detection of the virus.
Thank you so much for the detailed information about testing. Can you talk about testing for coaches and trainers and, the people who engage with the athletes on a regular basis?
I'll take that one. So testing protocol for coaches is going to be determined on the risk level for each sport. At a minimum, our coaches that are involved in intermediate and high risk sports will be tested weekly. Those higher risk sports such as basketball, squash, and volleyball will be tested a little more frequently. But in addition to the coaches for those sports, we're also going to be frequently monitoring the health of our athletic training staff through frequent testing, as well as our strength and conditioning staff through frequent testing as well.
Thank you. And Dustin, this is a question for you. In addition to the testing that you just talked about, will student athletes also participate in the regular surveillance testing that the campus does? Or will the testing that they do through athletics kind of take the place of that?
So unfortunately, there's no easy answer to that. It depends on whether they're in preseason or they're in season. And so it's going to change according to the amount of play basically that they're in at that moment. There may be times that they will be participating in the campus surveillance testing, and there may be times that they're participating in athlete surveillance testing. What won't happen is that they will not participate in both at the same time.
That is very helpful. Thank you. Another question just about contact tracing, Dustin, and how contact tracing works within athletic teams. If a person in a team gets, is test positive for COVID-19, does that mean the whole team is quarantined? How does that work?
So we have trained contact tracers on campus, and we've been really lucky with contact tracing over the past semester in really fine tuning the way we do it. And we have had athletes that have tested positive, and we've had to go back and find ways to figure out who they may have come in contact with. Some strategies that we've used in the past is to, for instance, review the game video that most teams record. We've looked at things like cameras that are in different locations when we know that a person was in that location for a long period of time to see if maybe someone was sitting next to them that we could identify. So there's lots of different strategies that we can use. What the strategy that we probably would be least likely to use is to have a one-size-fits-all experience where we say, well, someone from this team was determined to be positive, and so therefore we're going to quarantine the whole team. it really is about contact. It really is about that 6-foot experience. It really is about mask wearing. All these things fit into it. What I can share with students is the more mitigating practices that they use, the less likely they are to be a close contact. And so I would always urge students to really think about things like, I'm standing on the sideline right now. Am I standing 6 foot from the person that is closest to me or not? Sometimes we forget about those things. Sometimes we don't think about that during practice. And as we see those times start to add up, so for instance, I've been near someone who was tested as positive over a cumulative period of 15 minutes during this practice. All of a sudden now I have to go into quarantine because it was cumulative. Whereas if I had just spread myself out a little bit, I'm less likely to have to go in quarantine.
Can you talk about the CDC has changed some guidance around quarantine for close contacts? Can you talk about that a little bit?
Sure. So the CDC has given recommendations for some changes around quarantine. And so it's important to understand that those are recommendations, and those recommendations were given to the states. And in Ohio specifically, Ohio said that the counties are the ones that are allowed to make changes to the quarantine requirements of people with that are close contacts. What I can share with you is Licking County has made it very clear that they are going with a 10-day quarantine period. And so there is this recommendation that the CDC has allowed someone who tests 7 days after or 7 days into quarantine is allowing people to leave quarantine at that point in time. Licking County and most counties in Ohio are not following that recommendation. The recommendation that they are following is the one that says that you should stay in quarantine for 10 days. And so Denison will be using the 10-day time period for its quarantine. It does not matter whether you test negative or positive on day 7. If you are a close contact of someone, then under Denison's policy, which is a reflection of Licking County's health department requirements, you have to stay in quarantine for 10 days.
It's an upgrade from 14 days, right?
It is.
That's terrific. And I'm guessing, Dustin, just for those who are on campus in fall, know this, but we have dedicated quarantine and isolation spaces on campus. Students who do have to be in isolation and quarantine will receive food delivery and other kinds of support. I do also want to say, because I know this is a big question for students, because the semester is different, because not every single class is going to also be offered remotely. I know students have asked questions about, well, what happens if I do have to go into isolation or quarantine? Faculty will work with you in those cases, even if it's not a class where they are also conducting it remotely. Obviously, you have to be out of the classroom, and your professors will work with you to figure that out and ensure you can stay up on your coursework. Like we would if you were sick at any other time in any other semester. So don't worry about that. We have it taken care of. I just want to ask Trish, you had mentioned earlier about bus trips and keeping students safe on bus trips. And I just want to say, maybe to both of you, I think I want to clarify the conversation we just had about contact tracing and close contacts, it also wouldn't necessarily be true that if somebody is on a bus with someone who happens to have been test positive, that every single person on the bus would have to be quarantined, or no?
Our goal for contact tracing in terms of busing, one, we're asking the coaches to consider travel rosters so that we can minimize the number of people on the bus. As much as we can, try and space everyone out across the bus, so fewer players traveling will help with that. We've also recommended, in meeting with our winter coaches earlier this month, doing things like wearing face shields in addition to masks as just an extra added layer of protection. And the other thing we're asking coaches to do is to keep seating charts or offer assigned seats so that we know that every day this person sat next to this person, so that we can hopefully not take down an entire bus of athletes. So it's not a given that that would happen, but the biggest thing is how can we prevent that as much as possible? And part of that is, again, the frequency of testing, but also understanding that frequency of testing doesn't necessarily mean that, we're not going to have cases and cases of spread.
We're investing a lot in testing, not just student athletes, but we're going to be testing the whole student population more this semester than we did last semester. But all of that testing does not mean that there is no COVID on our campus. And it doesn't even mean that because you have a negative test today that you aren't positive for COVID. So can you just talk maybe again, because you probably already covered it and I didn't hear it, but just really the false sense of security and how we avoid that this semester to ensure we're still protecting ourselves and one another.
I think it's important to remember that there's a difference between being tested frequently and having a vaccination that allows you to have some immunity towards the virus. Even athletes or students in general who have had COVID in the past, we don't have enough data to show that there's immunity lasting terribly long beyond the 90-day time period. So again, it's really important. That doesn't mean that if you've had it, you can't get reinfected. So that's where we really want to stress these mitigation strategies with the hand washing, the masking, the social distancing as much as possible. We don't have the ability to create a bubble like the NBA and the NHL did over the summer. So in looking to professional sports and Division I sports, we see that almost every week we're seeing games get canceled or teams lose several groups of the same position because there has been some spread. So the best way to kind of monitor that and limit it from, or at least prevent it from spreading to an entire team, is this frequent monitoring at our higher level or our higher risk sports. So again, we also have to account for the fact that we have employees coming off campus or coming in from outside that could potentially be, carrying the virus. And then with athletes, we're allowing them to have some outside competition, but with that comes the risk of going to another campus. Now, our goal is to participate against teams that have a very similar testing protocol as we do, so that, again, we can minimize our risk as much as possible. But everyone needs to understand that there is going to be some risk with playing and participating in athletics this semester. It is virtually impossible for us to play outside opponents, continue to be a community with faculty and staff, and be in a bubble. It's just not something that's possible. So again, like, we can't get overconfident and think that we can allow certain things to slip. We can't let the mask slip off on the bus and just sit there and talk with a friend. We can't hang out in the locker room after a game. These things without our masks on, these things kind of have to be, we have to even take them to a higher level than even what we had in the fall because of our risk of exposure to the outside campuses.
That's terrific. Thank you.
Kristen, can I add something to that?
Yep, absolutely.
I just want to make sure that we reiterate what our numbers looked like last semester, for students. We had 18 total cases on campus, which is phenomenal compared to many of our peers. Of those 18 cases, only one was symptomatic. And so I completely agree with Trish that those mitigating strategies are the most important thing that we can do. 17 of those positive cases would have never been identified because they were coughing or because they had a fever or a temperature taken somewhere or something to that effect. And yet all of those people were able to pass that on to someone else. And so it's really important to understand that those mitigating strategies are not there to prevent us from catching the virus from someone who is showing symptoms. It's really there because it's so difficult to identify who may be spreading the virus and not knowing it. And we may be that person that is spreading the virus and not knowing it. And so the mask wearing is not to protect me, it's to protect me from spreading it to someone else. And in athletics case, it's to protect me from spreading it to the rest of my team, which prevents them from continuing on their season. And so I think it's really important to understand that asymptomatic transfer of the virus is so important to stop compared to the symptomatic.
And I do just want to say, and correct me if I'm wrong, Dustin, but with regard to vaccine, because Trish, you mentioned it, we are in constant contact with the Licking County Health Department. We don't have any concrete information about when the vaccine might be made available for our campus community. We do address the vaccine in the community care agreement, saying that if we determine that we want our student population to get the vaccine, that students would agree to do that. But we've not made any of those decisions. We don't have any concrete schedule or anything like that at this time. And it's just going to be something that we will continue to keep students, faculty, and staff abreast of moving forward. Is that a correct summary?
That's a great summary. We've done everything with Licking County in order to guarantee that we would have access to the vaccination if it becomes available. And we've done the exact same thing with the state. So we're pursuing every avenue we can in order to get access to the vaccine. Once we have access, then we make a determination, what is the best next logical step. For example, if the vaccine comes in too late in the semester, because it is a double dose vaccination, if we get access to it at the very end of the semester, we may not be able to administer it because we may not be able to administer the second dose. So we're doing everything that we can to understand when the vaccine might be available, what is the best strategy for using a vaccine with our campus, and then preparing our facilities in case we do get the vaccination at some point in time.
That's great. Thank you. And I will say on a very positive note that the vaccine was made available to you, Dustin, and your team at the Wellness Center, and also to trainers, right? And to some other folks in the athletics. So it is happening on our campus, and that is very, very exciting news. Congratulations. The rest of us are jealous out here, waiting for our number to come up. So with that, I just want to end. I want to ask Nan if you can just provide some final words to student athletes and families as we get ready to embark on spring semester.
Yeah, thanks, Christy. I can't say enough of how proud I am of our students and our coaches and our trainers and everyone involved, not only in the success of last semester, but all of the detailed preparation we've done since the end of last semester. Trish mentioned and Dustin mentioned some of the mitigating factors. We are looking into the data that suggests what is the safest way to travel and how to travel. Trish mentioned the seating on the bus. We also will not be eating on buses and doing things that we typically did. We'll be very, very careful, but we will provide all of that data to you. Your coaches will continue to stay very connected with each of you and your team collectively, and provide the information as soon as it's made available to them. As you know, much is uncertain in the world right now, but I think some things that are certain and that we can rely on are your passion, your commitment, and your care that you bring to the athletic community and to each other. And the collective behavior of each of you is so impressive. You know, I am pragmatic. I'm a pragmatist, an optimistic pragmatist about the season ahead, but I am optimistic. As I mentioned before, we have an important opportunity to have a great semester and to enjoy and benefit from the opportunity of competitive play. I believe in our student athletes. I believe in each one of you, have confidence in each one of you. And I believe we will continue to draw on the resiliency and agility that is so important to many aspects of being a student athlete. So go Big Red.
Thank you, Nan. I always end these sessions, if you've watched them previously, by reminding you to get up-to-date information at reopen.denison.edu. You can submit questions to reopen@denison.edu, and we'll continue, as Nan said, you'll get information from your coaches. You'll continue to get emails from President Weinberg. You'll get weekly communications in our weekly Friday newsletter to students and parents. We'll just continue in many, many ways to keep you updated on our plans and then on how things are going as we are back on campus together for the semester. Thank you, and we will see you soon.